Identified patient like a sick child. This is the individual in the family who is identified as having the problem. They are the one who has the most symptoms, which can be either substance abuse, mental illness, or another behavior problem. This person tends to carry the symptoms of others as well and to be the one who is identified as needing help. They present symptoms to others and frequently feel fear, guilt, shame, and very lonely. They tend to feel that the only way to get attention or their needs met is to be sick, which can be physical or emotional. Primary enabler. This is the person who is the martyr. By the family, they are viewed as the protector or the rescuer. Frequently, despite good intentions, they rescue people to the detriment of not only themselves, but the person being rescued and the rest of the family. Although they tend to present as organized and responsible, they frequently feel angry, mistreated, and can be prone to physical problems as well. These are also individuals who tend to be very intellectualized and can excuse or create a viable reason for almost any behavior, therefore, are not likely to follow through with consequences or directly face any problem. Hero. This is the good child. The one who tries to please everyone, who tends to be success-oriented, do what is asked and go above and beyond to make others happy. They are dependable and responsible, but often are over-parentified, out of touch with their own feelings, and can be prone to a breakdown if overwhelmed or unable to meet the unreasonable expectations they place upon themselves. Often, they also feel inadequate and that they are fake and worry that they will be found out as not being as together as they present. This can lead to anxiety. Scapegoat. This is the child who feels that they cannot live up to being the hero, so why bother trying? They tend to go against family values, can be prone to being a behavior problem, having substance abuse issues or anger problems. This child is the one who takes on the role of being blamed for almost everything that goes wrong in the family, and their identity is tied into getting negative attention. They present with behavior problems and anger. Inside they tend to feel very hurt, sad, and angry. When this role carries over into school, it can cause severe social skills problems as they tend to be the one blamed by other kids and frequently bullied or teased. Lost child. This is the child who withdraws into themselves because they do not have the ability to cope with the family. They tend to be isolated a lot of the time, feel most comfortable when alone, but also intense loneliness and can be at high risk for depression. May be very involved with animals or books, things that are easier to deal with than human relationships. Mascot. This is usually the youngest member, but not always. This is the child who tends to try to put on a happy face and make everyone laugh. They may be silly, inappropriate, and sometimes hyper. They tend to be immature for their age and be the class clown, although they present as silly, and may be the bright spot who can cut through tension emotions. With their antics, they can struggle with a lot of fear and inability to cope with the truth.